Historically, levels of healthcare has been very minimal and sometimes non-existent in some days, some weeks. Over time, it progressively, started to get better. It's not that we're not there yet, but it is better than before.
We have about six nurses and doctor visit every 3.5 days out of every week.
A routine visit to the doctor could take months, and sometimes you don't know. Sometimes you just put on this waiting list and you never hear again, and you have to keep at it, and eventually you get your visit. So
it does become a problem for people who are really sick and need to see a doctor. But like I said, services are slowly improving, but we do need more doctor visits.
And it has improved quite drastically, but not to the level that we would like to see.
Well, we've been talking about health for the last 20 years, how, we're always, harping the government that, they should provide more services up north. And it's not getting any better, so we decided that we wanted to, take the challenge of, promoting our own health services. All our needs are similar, except that, we need to have better access, to the community and better access to the city for, a better coordinated service.
We decided to do something about it, sort of fast track it. We've heard the same old problems time after time, year after year. Let's do something about it and to improve the quality and the services for people in our communities.
We wanted to have influence over how care is provided into our communities. We know what the issues are. We just need to be able to take the initiative to say that we want our members to get better services than when they had before.
just through regular meetings and just seeing each other has led to this initiative on how can we work together to make things better for our community.
We formed a Quest Health Clinic in a partnership sort of a model with the people from Quest Inn and the 4 communities.
This initiative has been underway, I think, since 2012. In terms of the quest to have, this quest in a different way, to have gain greater control of our health services goes back to right from the time that treaties were signed. So we've always been trying to make things better for our community members.
There's a lot of response, good response from people, especially in the area of mental health, where they want to get involved in this week-long mental health program that we have going.
We got to be able to, provide our own solutions for our own issues. We understand our own issues better.
Mental wellness is a big issue to our community, as all the First Nation communities. We have a high number of people that need mental health care, and we have nothing at the moment, or before we had Quest Health. Now we have healthcare. Mental health people visiting our communities on a regular basis. Our members are very pleased to see that.
Yes, it's always been a problem in my community, and we're trying to address that, and with the help of the other 3 communities and the Quest Health Clinic, the government is slowly realizing that there is a big problem at the community level with mental health, and they're trying their best to try and address the problem with us.
Well, since Health Quest has had mental welfare workers in the community, we see our people, our mental health people are happy to have them, to talk with them, and that is very helpful. Then that lifts up their spirits, and we are happy to see that.
There's been a lot of positive response from people. It's a sense of pride in having ownership of a facility that would address their health needs, start to address their health needs, I would say. Basically, it's been a good response, positive response. There are questions that people do come up with, and we do answer them, you know.
Well, they get to own the Quest Health. They get to own a piece of the Quest Health. They get to have a say piece of the Health with the outside agencies providing they don't own anything.
Our community values it very highly because when you have control and you have your own solutions, you have a greater chance of success. And with success breeds pride. And there's a pride of ownership that comes through that that really, I don't know, makes you feel good.
Our members are very happy of the step that the Chief and Councillor, the partnership of the Health Quest is taking, and they are very, very interested to know more about it, but they are very happy of the steps that we have taken. Once we have Quest Health fully established, fully servicing, I would think that the communities will benefit a lot with the service that the Quest Health will provide, that we do not see that's available to the First Nations members through Health Canada.
With us owning the Quest Health Clinic and being a partner in the setup, it gives a sense of pride and ownership by the community members. They like the fact that they stay at a accommodation center where they are part owners, and so there's a sense of pride, a lot of pride, and that does have a positive effect on their health. One thing that stands out in my mind is I keep forgetting to say this whenever I talk about our health issues, is the elders say that health is a treaty right and has always been a treaty right, so, but the government sees it otherwise. So I try and uphold that thought for the elders.
You know, having a facility in Winnipeg assists our members because, you know, like it or not, this is where all the action is. This is where all the major hospitals are. This is where all the specialists are. So having our own facility here helps coordinate services and gets people to their appointments, gets people to do the things that need to get done in a coordinated way.
Well, the community really appreciate owning our own solutions because it's community driven, and you know, the more we uncover things in the community, you know, like I think we're only hitting the tip of the iceberg. We will have to continue, you know, progressing in our quest for more resources and more services into the community.